Well, whether it's fashion magazines or exercise magazines, those images of beauty and fitness are unattainable for most of us. That's especially true when it comes to muscle development and definition, particularly in the abdominal area. But you might be able to get a lot closer than you think with a little plastic surgery. If you look at any of the exercise magazines these days, you see abdominal muscles that are hard to believe. But you try anyway. Lift weights, diet, and do ab crunches till you can barely move. And do you get six-pack abs? More likely you get this. That was Terry Wiseman's problem.
Did my sit-ups. Have done some pretty intensive weight training also in the past. So I've got some pretty good upper body strength. And
Terry's hardly fat, but his well-toned abdominals are obscured by a genetic predisposition to collect what fat he does have right where he doesn't want it.
This is just a layer of fat. You look, it's not up here, it's not here. This is where he collects fat. And a lot of men, it's very common for this area in men.
And so Terry has opted for a relatively new variation of liposuction that concentrates the fat removal right over the abdominal muscles. The key to this is very thin cannulas that allow Dr. Tornambe to get very close to the skin without injury.
You don't want to take too much fat where you're going to have allow the skin to be too thin and allow dimpling and not a nice even smooth surface, but you want to take enough fat to allow the natural musculature to show through the thinner skin and without the fatty layer.
The results are a significant reduction in fat, which makes a big difference in appearance and waist size, although true six-pack abs will still take a lot of work.
hopefully this will actually incentivize me or make it even more pleasurable to go to the gym, because I know that the results will show up more quickly if the layer of fat is no longer there.
And Dr. Tornambe says most patients only have to rest for a couple of days and then they can go back to work. They will have to lay off exercise for a couple of weeks, and as in all liposuction, they will have to wear an elastic compression garment around their middle for a few weeks. By then, most of the swelling should be gone and it's a whole new you. And Dr. Tornambe says that you have to be careful not to remove too much of the fat, though, because the result is a dimpled, bumpy appearance, and that, of course, doesn't work very well. The other thing is the cost. Beauty doesn't come cheaply. It's maybe $5,000 to $7,000, depending on how many areas you have.
And not covered by insurance, usually.
No, not for this.
It's considered cosmetic.
Correct.